Hi, we're continuing with this series of videos for parents with children with borderline personality disorder, children who are adolescents, young adults, and so on. What I want to talk about today is complex, and I hope it comes off properly in this video. And it concerns the reality that while your child will probably have a therapist, there may be a family therapist involved. Hope to God the pediatrician is properly involved as a primary caretaker coordinating healthcare issues for your child. Nonetheless, you as a parent, you have to know a lot about the disease process or the disorder or the syndrome or however you want to refer to borderline personality disorder. Whenever you have a child with a serious and chronic medical issue, particularly a medical or physical problem that can be disabling or intermittently debilitating for the child or adolescent or young adult, you need to know about the enemy. You need to know about the disease, its process, how it manifests itself, what it looks like during acute periods, what a more chronic picture looks like, and so on. This is no less true for BPD. As a parent, you need to have a sense of the criteria of BPD as found in the DSM-5. You need to have a sense of the criteria as found, I hope, in extended criteria that I have in my book, which are not found in the DSM-5, but crucially reflect functioning for the borderline. In other words, you need to become an expert and know how to treat it, know how to intervene. And like any disorder or disease or issue of that kind, there are kind of secrets that, often doctors themselves don't know that you can find on the internet. Hopefully what you're looking at on the internet is valid and not hokum. But it's important to really be an expert. To be an expert in two ways. To be an expert generally about what the disorder is and how it manifests and how to intervene and so on. And second, to be an expert with specific regard to your child's issues. So with specific regard, for example, as to what triggers your child towards bouts of intense anger, rage, what triggers your child towards moments of intense anxiety because of fears of abandonment, what triggers your child towards impulsive acts of self-harm or even engaging in dangerous behavior outside of the home, and so on. So what I'd like to suggest in a very real way is that just like if your child had a medical issue, you'd want to become an expert and understand it as much as possible, even while deferring and gaining a great deal of support from professionals in the medical community. Similarly, it's crucial as a parent to learn about this issue, borderline personality disorder, generally, almost as a healthcare professional would, and secondarily, as a parent, understanding how this specifically pertains to your child in your child's idiosyncratic way. So let's talk about this a little bit. The first thing I want to say is that there are high-functioning and low-functioning people with borderline personality disorder. And that's the first thing you should know with regard to your child. High-functioning individuals are simply individuals who are able to engage in everyday behaviors. They go to work, they're able to attend high school, college. They often have a normal interpersonal functioning. They engage in hobbies, activities, and so on. And in contrast, you have low-functioning individuals. And these are individuals who seem at times quite debilitated because of BPD. They seem disabled. They seem unable to get on with their lives. They seem trapped. These are individuals who have chronic or repeated difficulty with academics, socialization, vocational issues, and so on. And for the high functioning individual, sometimes parents and adult friends or professionals will scratch their head and say, does this person really have borderline personality disorder? The person seems to be doing so well in so many areas of their life, but in fact they may. Similarly, you may scratch your head and think, my Lord, this is so debilitating for the low functioning individual. They seem so powerless and overwhelmed and unable to get on with their lives. In truth, most people have both. Most people have periods of very low functioning, and most people have periods of very high functioning. And what occurs with the high functioning individuals is that they have periods of acute problems where they particularly become acutely depressed or acutely anxious. And at those times, they may need, a weekend in bed by themselves, socially isolated, not doing anything, until they recharge their batteries and feel sufficiently strong enough again to enter the real world. You also have people that are low functioning that have periods of strength where they're able to engage in the world. And you also have people who are low functioning who have certain hobbies and activities that they may really excel at and allow them not just an endeavor that occupies them in a healthy way, but boosts their self-esteem and allows them to feel better about themselves, gaining a sense of self-worth and so on. So with your child, the fact, and I've spoken about this in other videos, that your child may be low functioning doesn't mean that your child may not have periods and inner strengths that individual can tap into to really lead and enjoy a much more positive life. Similarly, the child or adolescent, young adult who seems to be doing well overall and is high functioning, you must keep in mind as a parent that there could be real periods of acute, debilitating anxiety, depression, and so on, even moments of self-harm or risky behavior that can be, quite endangering to the individual. The next thing I'd say is that there's very poor predictability with regard to how a person does in childhood or adolescence as compared to adulthood. There are plenty of people who struggle academically in school, the C student, and the person can actually be quite successful as an adult for a whole host of reasons, including that they have, high emotional intelligence. They may have particular abilities that are simply not recognized in their school programs as they're growing up. They may have a real sense of business, for example, or entrepreneurship that is really not at all considered important at younger ages, all sorts of reasons. And similarly, everybody knows of high achievers in high school and even college who don't do well. Perhaps they burn out, perhaps they have unrealistically high expectations of themselves and they disappoint themselves in their 30s, 40s, and so on. Some of these people who seem to be high achievers probably have undiagnosed mental health issues, perhaps bipolar disorder, that are not properly addressed. And so overall, there's little predictability, and remaining positive, encouraging, always hoping for the best while being realistic about issues sometimes could be the most helpful thing for your child. For all of these then, for all of these groups, life skills development is extremely important. Life skills concern strategies and methods to deal with everyday issues in life, particularly the big issues, interpersonal, academic, vocational, and so on. And with life skills development, the individual can be taught, it's sometimes called psychoeducation, to contend with issues that would normally be, or under different circumstances, overwhelming or debilitating. Ultimately, we want the person to be able to live a more dignified and a more meaningful life. And not necessarily as parents what we think is a more dignified or meaningful life, but what is a more meaningful and dignified life for the child. And, I always say children surprise you. You see children who have particular learning issues or developmental problems, and they shine in high schoolers, young adults, or as they grow. Many of these individuals will also change pathways. And changing pathways academically, in terms of professional interests and so on, is not necessarily a bad thing at all. In fact, it's not unusual for borderlines to feel bored or unsatisfied, or feel that they're wasting their time with particular educational or vocational routes that they've taken. And they should not be discouraged to consider very different routes. One may be in science and the arts may be much more attractive. An individual may be in a 2-year college program for an associate's degree and want to switch over to something much more challenging in a 4-year undergraduate program, and so on. The next thing I want to talk about in this area is that it's important as a parent, when trying to understand this, to work conceptually. There are no biomarkers for psychiatric problems, even Alzheimer's. We don't know. The only way to actually, and this is not always true, but to diagnose this is post-mortem, to look at the brain. But there are no biomarkers for depression and anxiety and borderline personality disorder and so on. And so people that work in mental health have to be kind of smart in the sense that they have to be able to conceptualize and understand these issues generally and as it applies to a particular individual in the absence of any kind of medical testing. Now, it's true there are psychological tests, mostly self-report questionnaires that are used for depression, anxiety, OCD, PTSD, and so on. I don't like any of them. The problem is when these forms, these self-report measures are filled out, people don't understand them, people lie, people over-exaggerate, people under-exaggerate, and so on. And it's therefore very important for the clinician and certainly the parent who wants to understand this to have a conceptual understanding of what's going on. It's even more serious because there's some mental health experts that don't even believe borderline personality disorder exists at all. They think it's a misdiagnosis or perhaps a misclassification. And you have others who absolutely think that this is a crucial psychiatric consideration that requires study in its own right. As far as I'm concerned, the most important thing is to focus on the human being's presentation, and that could be nuanced. It could be very subtle, but ultimately we need to understand how the child presents or the young adult presents, and we need to always remember that we can ask the child or the young adult all sorts of questions as a parent or as a healthcare professional, and the child may not understand these issues. The child may be living with borderline personality disorder for years and years. Doesn't mean they understand the issue. Similarly, in medicine, you may present a medical problem that you've been contending with for a very long time. Doesn't mean you understand the issue. Doesn't mean you have any sense of the source of the issue or why it's there. I remember many years ago, I went to a doctor. I had a pain in my front, and I assumed it was because there was some problem in my front. That doesn't seem to be rocket science. And I went to the doctor, and there was absolutely nothing wrong with me in the front. It had to do with my back. And what occurred was that the injury was radiating pain towards the front. I didn't know. I'm not a physician. I'm not a. I know nothing about orthopedics. I don't know that much about. I know very little about neurology. How would I know? Well, I went to a physician, and that person knew. But the point is, you may have a child who's now even a young adult, who has been contending with these issues for many, many years. Don't assume that your child is an expert. Don't assume just because your child is living with these things that they're an expert. The other thing is that humans are dynamic. We're changing creatures, so that criteria that seem applicable to the person at one point in their life may be very inapplicable or even misplaced at another point. Indeed, a person may have the ability to abstain, for example, from impulsive behaviors all week, attending to matters in a normal way, going to school, vocationally, and so on, and yet reserve their impulsivity for the weekend when they can act out and do what they wish in a more contained temporal way. Clearly, also, two people can present with BPD, and yet their symptoms and their presentation can be very different. And that's why it's necessary to have a way to evaluate and consider what's going on with the individual. In mental health, we have something called the psychosocial evaluation, which parents should know something about. I have many of these issues in my videos in my other YouTube channel. But the psychosocial evaluation is basically a key strategic tool used by clinicians to elicit information to learn about people and, as I said, conceptualize general functioning and mental health issues, also revealing all kinds of issues and a host of details about a person's life. And just to give you some sense of it, in the psychosocial evaluation, look at childhood experiences, both objective and subjective, the quality of family members' relationships, sometimes called family dynamics. We look at adult development over the entire lifespan, the perception of self and other through experiences and interpersonal functioning. We look at influences in the home, community, religion, culture, values. We look at the person's community interaction with regard to education, employment, socialization, medical, physical, psychiatric issues, major stressors in the person's life, including trauma, shame, loss, resentment, fear, jealousy, guilt, any challenges or frustrations or disappointments that person may have encountered. Strengths and vulnerabilities, that is, the individual's ability to be resilient against stress, and look at how the person defends themselves when they feel stressed or attacked. And the person's core hopes and desires, dreams, their drives, and their motivations. And, I don't want to make it sound like the parent has to be a clinician, but these are things to actually consider so that as the child grows and develops, these are things that you can consider discussing with your partner, with your spouse, about the child, and consider where they may have some strengths and some difficulties, different issues in their lives that may impact and inform their BPD issue. Again, there are no biomarkers, but the gold standard in its stead serves as a irreplaceable way to conceptualize an individual clinically, developmentally, and so on. There's been so many testing options available in terms of genetics, neuroimaging, neurophysiology, testing, and so on. But the truth is, absolutely no medical or psychological test can replace the simple question, how do you feel? No test of any kind can replace the question, How are you doing today? What's going on in your life? How do you feel? And it's important to maintain a very humanistic understanding of mental health, because ultimately you're dealing with a human being who may be fragile and just underneath the surface, vulnerable and prone to all sorts of issues related to the borderline diagnosis. The secret to clinical expertise, even though you're not a clinician, the parent, is to assign clinically significant meaning to seemingly unimportant behavior, emotion, and thinking. That is, your child in his or her everyday life, and I sort of hinted this in some other videos, will present in a way that seems quite everyday, quite normal, quite benign. But don't just accept your child at his word. Look for what's going on in your child's life based on their emotion, thinking, and behavior. Think about their choices, their decision making, their interests, their proclivities, and so on. We make decisions. One of the great findings of research in the last 50 years is that we don't make decisions based on rationality. The rational actor model has gone out the window. Quite the opposite. We make decisions based on emotions. And then after we've made the decision, we look back and we rationalize our judgment. Similarly here, look at what's going on in your child's everyday life in a detailed way. And sometimes little hints, those little things can really set their everyday life apart from what's going on in that particular moment. For example, you notice that they're not using their phone or having contacts with friends at school for several days in a row. You notice that while they maybe enjoyed previously cooking with you or hanging out in the kitchen for one reason or another, I don't know, suddenly take all of their meals in their room, eating at their desk, watching YouTube videos. So it's not just any kind of change in the person's life. It's changes that may be quite specific to the particular child. This is not to suggest that every behavior, emotion, thought belies a symptom of psychopathology, but rather that behavior, emotion, and thinking have a particular meaning to a particular individual given his particular psychosocial history. So, just as an example I have in my book, fidgeting with your fingers, it can mean a lot of things. It can mean you have a neurological issue. It can mean you're fidgeting because you're talking to a healthcare professional and you're acutely anxious. It could be a familial thing that you've seen other members of your family do, or something that may even be genetically oriented. The fingering like this, fidgeting, may not be fidgeting as such so much as giving you a sense of feedback from the immediate touch. Fingers have a lot of sensory cells at their tips. What I'm saying is a particular issue can have many meanings, and the real trick is to assign the true meaning, the true issue as it applies to that individual. You're also, as a parent, looking for patterns of behavior, not just pathology, but health. You want to look at how the person is doing in both a positive and negative sense. In other words, from a positive sense, what are those things over a period of months or years as patterns that really seem to be benefiting the person, increasing their contentment and happiness and sense of self-satisfaction? And what kinds of things are just getting them down and harming them and impinging on their self-esteem and so on? When we start to look at this, we can also see when those patterns break down, and if they're not perhaps specific things that particularly serve to poke a hole in those particular patterns. Um, for different people with different problems, it's different issues. The most well known is, for example, people that have autism, and this is also true for many borderlines. They really benefit from sameness, from predictability, from certainty. Because if you have predictability and certainty, you have much less need to be hyper vigilant about your surroundings. You have much less need to be guarded. You have much less need to be suspicious. And so you can enjoy your immediate surroundings and whoever's around you and your activities in a much more healthy way. Patterns are also an important concept because it is crucial to recognize specific behaviors, emotion, thinking that exists or repeat over a long period of time, so that pathology is indeed recognized in the context of a person's overall functioning. Obviously, pathology can also occur in acute forms. For example, someone can experience severe psychological trauma or even psychosis after, for example, being sexually abused. At other times, however, pathology is not recognized, and so for whatever reason, no pattern may exist. We see this, for example, in cancer. You can have a cancerous growth, but because there's no symptoms or pain, the person may live for months or even years with that growth that has not been discovered because there's no red flags about it. Still, BPD has to be understood as a disorder because it is potentially debilitating. Whether you use the word disease or disorder, I think at that point you're getting into nomenclature, but for those people that are indeed debilitated and limited and suffer emotionally, psychologically, even physically because of borderline personality disorder, they themselves subjectively will tell you that it's a disorder or a disease. And certainly parents who see their children suffer in this way will also more objectively understand how it negatively affects the child. Ultimately, though, the goal is to humanize the person and not to label the person and not to pathologize them. The reason why things like borderline personality disorder as a name of a disorder are good because it helps to identify a group of criteria or symptoms which taken together form a picture of a particular disorder. And that's called a syndrome. That's how I understand syndromes. I understand diseases as something quite different. A disease is something empirically understood by, for example, unhealthy cells or unhealthy tissues or unhealthy organs with specific biomarkers. A syndrome, as I understand it, in contrast, exists as a set of collected criteria that we can observe and understand, often conceptually, especially in psychiatry. It doesn't make diseases more serious than syndromes. To the contrary, syndromes are in a sense more serious because they're more difficult to conceptually understand. I think that's all I'm going to talk about today. What I'd like to present next time are different models to understand borderline personality disorder as I have them in my book. Developmental models, complex trauma models, and an idea about autoimmune and TBI models that I think may shed some further light on how to conceptually understand borderline personality disorder.